As diphtheria cases continue to surge, 19 states have been urged to consider instituting compulsory face covering requirements, such as nose masks, in public gatherings in order to slow down the progress of the diphtheria outbreak. Health agencies made this recommendation at the inaugural Diphtheria Emergency Task Force team briefing to give an update on the situation of the outbreak and response in the country. Health correspondent Kemi Balogun has details.
Since the confirmation of the re-emergence of diphtheria in Nigeria in December 2022, Nigeria's health agencies swung into action to curb further spread of the disease. The ongoing outbreak is affecting states like Kano, Yobe, Borno, Katsina, Kaduna, and Bauchi. Kano remains the epicenter of the outbreak, bearing the brunt of more than 84% out of the 97% reported cases. The concern among these health agencies who make up the National Emergency Task Force team on diphtheria is the risk posed by the large number of the unvaccinated or partially vaccinated who make up more than 64% of all recorded cases.
The federal government recognizes the power of vaccines in safeguarding public health, and our response to this outbreak centers around the belief that vaccination is our most formidable weapon. We have two vaccines at our disposal: the pentavalent vaccine administered to children aged 6 to 4 years and the tetanus diphtheria TD vaccine provided to children above 4 years to 14 years.
Currently, 14 laboratories that we've optimized in the network to be able to do basic diagnosis of diphtheria. What we expect is that if you've got symptoms that are suggestive of diphtheria, you go to, in those states, you go to the treatment center to be investigated.
The outbreak is affecting children between 1 to 14 years, which is actually, again, a big concern, and this is the school going edge. Our recent assessment is WHO. We still place diphtheria as highly infectious disease and as a cause of concern from our side, hence the reason why we're also mobilizing more resources to make sure that this outbreak is controlled.
So far, Nigeria has recorded 13,204 suspected cases, out of which 8,404 have been confirmed cases across 114 local government areas in 19 states, including the FCT. The task force is now urging state governments to consider reintroducing the use of compulsory face covering, especially in states with a high burden.
By so doing, we can add another intervention to slow the progress of this outbreak, particularly in states like Kano.
The National Emergency Task Team was set up last month by the Coordinating Minister of Health and Social Welfare to enable a higher level of coordination of the diphtheria outbreak response efforts. Kemi Balogun, TVC News, Abuja.